Hello, my name is Emma Weekly, and today we are doing a shift assessment. So first I would start off by walking into the room, introducing myself, telling them what's going on. So, hello, my name is Emma Weekly, and today we are doing the head-to-toe assessment. And then I'd ask some other questions. What do you go by? What is your preferred name?
Jody.
All right. Do you have any pronouns that you would like to go by?
Her or she.
Okay. And then, are there any culture considerations I should be aware of and respect?
No.
All right. After I ask that, I'm going to wash my hands and then conduct the exam. So first we will do vital signs. I'm going to get her blood pressure. All right. If you could just hold out. This is her right arm. All right, so I got 125/72. That is pretty, that is with normal limits. Next, I'm going to get her heart rate. So I'm going to take this off of you. By doing the heart rate, I am just going to assess her pulse. Look at my watch for 30 seconds and then times it by 2. Let me do it this way. Okay, while I was doing that, I was looking at her respirations, which I got 6. I got 7 respirations in 30 seconds. So I would times that by 2 as well, and I got 14. As for her heart rate, or her heartbeat, I got 34. So times that by 2, and you get 68. And then I'm going to take her temperature. All I have is this thermometer, so... I don't know how to use this. Alright, stick this under your tongue. And then I guess while this is happening, I can go ahead and talk to you about it. We're going to start by assessing her skin. And to assess the skin, we're going to look at her overall color, and if there are any lesions, wounds, redness, anything out of the ordinary. I'm not going to take off any of her clothes or anything, but you would like to look everywhere. Okay, I want to take a break. Her temperature was 97.0 degrees Fahrenheit. After that, I'm going to ask, do you have any pain?
No.
Alright, and then there are the vital signs. So let me continue with the skin. So you're going to assess everywhere, from the back to the bottom, full on head to toe. But for this case, I'm just going to assess where I can see her skin. So I'm going to look, see her overall color, maybe feel it, see if it's dry or flaky. Everything is normal. Her color is in normal limits. I'm seeing no wounds or lesions, and it feels not too hot, not too cold. Everything is in expected parameters. All right, after we do the skin, we're going to move on to the head and face. So I'm going to look at her overall color for this as well, and I'm going to look at her facial structures, see if they're symmetric, see if they're in place. Everything looks normal as I'm looking here. And then I'm going to look at her hair growth on her head. Everything, her hair growth is expected and healthy for her age. Everything is normal here as well. So next we're moving on to the eyes. We're going to look at position and alignment, see if they're symmetrical to each other. So yeah, they are symmetrical. Then we're going to look at her conjunctiva, which is underneath the eye. So I'm just going to pull it down, see if they're, pink. They're both pink. And then while I'm doing this, I'm going to look at her sclera, see if she has blood vessels in there, see if they're white, look for any jaundice maybe. Everything is normal. And now I'm going to do perla. So I'm going to look straight ahead, look at my forehead. I'm going to shine the light in your eyes.
Mm-hmm.
Okay. Alright, so pupils. Pupils were equal, rounded, and reacted to light and accommodated. Now, can you follow my pen light? Just your eyes. Yeah, just your eyes. Alright, good. Everything is good there. So next we're going to move on to ears. You can just inspect them, see if anything is going on, see if you see like any wound, any little lesions or something in the ears, but here it's okay. And then you're going to do like a little hearing test based on how you're talking right now to the patient, and as I've been talking to her, I can tell there are no hearing impairments. You can also ask if they have hearing aids or have anything done to their ears. After that, we are going to look inside the mouth. Will you open up your mouth for me? We are going to look for any lesions in her mouth. Look for moistness, and then stick out your tongue for me and look at her tonsil size. So her tonsils look normal in size. Her mouth is hydrated, and her mouth is moist, pink, and there are no oral lesions or anything out of the ordinary. So after that, we are going to look at the respiratory part of the exam. So, as I said, the respiratory rate was 14. So that was good. You're going to look at the chest, see if she's breathing effortlessly, and seeing if her chest is equal in size when she breathes. As I'm looking, it is equal in size. There is no barrel chest. You're going to look at the shape to see if there's any barrel chest, maybe it's rounded. And then you're going to see if accessory muscle is in use. So sometimes patients will breathe with their stomach, which usually indicates they're short of breath. As I'm looking, none of that is happening. And then just look for any abnormalities, and there's none. So after that, I'm going to auscultate. So we're going to start with anteriorly. You would do this underneath the clothing. But for here, we're just going to do it above. So I'm going to ask you to take deep breaths in and out. Okay. After you listen to that, you're going to move on to the back. So just spin around there.
Mm-hmm.
I should have told you, we start
You
off...
want me to do this?
No, it's okay.
Oh, okay.
Oh, yeah. Oh, never mind. Yeah, that's good. So you're just going to start off one section, go to the other, go down. Kind of follow a pattern here. And the posterior side is easier to listen to long sounds. So go ahead and breathe in. Okay, and then just to cut it short, after you listen up here, you're going to go down here and kind of go out. Do it on the other side. Go out just a tad bit more. Okay. As I listen to her lungs. They were unlabored, they were very clear, and they were strong in my stethoscope, which is good. Regular breath sounds, so everything was normal there. You can also listen on the sides as well to listen to the lung sounds. So you can face back as normal.
Okay.
After that, I'm going to ask you to cough. Okay, cough is normal. She can cough by herself. It's within normal limits. Then I'm going to ask, do you have any shortness of breath?
No.
Do you have any congestion?
No.
Okay, and there's the respiratory part. So now I'm going to move on to the cardiovascular. So we're going to inspect and see if there are her collar in the extremity part. Again, collar is normal. And then we're going to see if there's any edema, any swelling in there. Make sure you check both sides, and while you are doing this, you're going to look for even hair growth. So make sure that check to see if hair growth is even, if it's healthy, and as I'm looking, it is even and healthy. It's where it's supposed to be. It's in expected parameters for her age. You'd also do the same to her legs as well. Look for edema, check the collar, and check if hair growth is good. So after that, I would feel for the distal pulses. So let me see. Okay. And I should mention, it's your radial pulse, so you're going to take 2 fingers and touch right there. +2 in her upper extremities, bilaterally. And we're going to go down to her feet. Wish there was a better setup for this, but there's not. You're going to check her pedal pulse now by going between the big toe and the middle toe, going down, taking 2 fingers and feeling for the pulse lightly. Yep, good strong pulse there. Let's do your other foot. Good strong pulse there. Okay, +2 in those pulses as well. You can also check for the carotid artery pulse up in the neck. And while you're doing that, just check and see if there's any JVD. Okay, so you can check for hair growth. You're also going to look for capillary refill time. So it should be less than 3 seconds. You're just going to pinch the skin and it retracted right back. So you're going to do this in the rest of the extremities. Retracted right back. So that's less than 3 seconds. Do it in the legs. Just pinch her leg, not lightly, not hard. Just see if you can get skin to come back, and everything is regular. So now I'm going to ask you some questions.
Okay.
Do you have any chest pain?
No.
Are you short of breath?
No.
Okay. And now we will auscultate heart sounds. I did that a little bit out of order. I should have done the questions after I auscultated the heart sounds, but it's okay. All right. So first you're going to stay at the aortic. All right. Then you're going to go to the pulmonic. Then Erb's point. And tricuspid. And then I'm going to lift up. I'll share the bra on. And listen for the mitral. And her heart sounds sound normal. Okay. Her heart sounds are normal. I didn't notice any murmurs or anything. So now we will move on to musculoskeletal. So the musculoskeletal, first we're going to inspect and see if her muscles are symmetric in size, see if her arms and everything else is symmetric in size to the other body part. So you would just look and maybe just, hold the hand, see if everything's good. Look at the muscles. Everything is normal. They are symmetric. After that, you're going to palpate for tenderness everywhere. So you're just going to start by, just kind of feeling if the patient moans or groans or, says ouch, then they're in pain. Just check and palpate. See if you can feel any cysts or anything wrong, maybe any masses. You can even do the jaws, so you can tell them to clench down. Feel right there for that joint. You can feel for the joints. You would do it in the legs. Just feel around on both of the legs, and everything's good. So then after that, you are going to do the full range of motion. So I'm gonna let you scoot back in your chair just a bit for this one. I'm not gonna have her lay down. Normally the patient would be laying down, but I'm not gonna have her lay down for this. So first, I want you to maybe just like shrug your shoulders like that. Take your arms, put them up, put them back, touch them, put them up all the way. All right, her arms are good. Now let's do your elbows. Bend your elbows for me. Go back and forth like that. Okay, and then your hands. So I want you to push down, push up. Yep. Move your wrist around in circles. Okay, and then grip my hands. All her range of motion is full in her upper torso. Then for legs, when you're laying down, you would bend the leg up. You could bend it over like that. You could put it on the other side, and then you would do the same for the other. While she's sitting down, you can put your legs up, put them up. Good. Maybe like put your feet. Can you put them to the camera and point them inward?
No.
Okay, maybe not. Okay, put them inward, put them outward, and let's see if I can fix. Okay, then I'm gonna have you push.
Okay.
And then pull back. Okay. Now I want you to lift up on that. Lift out to the sides. Okay, good. She has full range of motion in her lower extremities as well, so everything's good. Now I'm going to ask, do you have any pain or discomfort while any of that was taking place?
No.
Okay, so that was good as well. There was no tenderness. Everything was normal. And her muscle strength was good, was normal everywhere, and strong bilaterally, very strong, which is great. So next we're going to go to the abdomen. We're going to assess for the gastrointestinal. So first you would lift up the shirt to inspect it. And what you're going to look for is maybe like any skin discoloration, any wounds, if the tummy is rounded, or maybe it's flat or concaved. After that, you're going to auscultate it. Lift up the shirt, start in the right lower quadrant. You're going to follow the transverse colon. Listen for vowel sounds, 5 to 30. Then you're going to go up to the right upper quadrant. Then you're going to go to the left upper quadrant. And then you're going to go down to the left lower quadrant. Okay. Normal vowel sounds there. Now I'm going to lightly palpate the tummy. Tell me if this hurts or anything. You're just going to feel around, see if you can feel anything, and then you'll deeply feel, maybe to see if it's tender, to see if it's firm or soft. And as I'm feeling, it's soft and non-tender. And then after that, you're going to ask, did you have any pain while I did that?
No.
And when was your last bowel movement?
This morning.
Okay. So after that, you're going to go onto the neurological part of the exam. You're going to assess for mental status, and you can do this by pretty much the whole assessment. Check how she is. She's calm, cooperative. Her mental status is fine. I'm sorry, not fine. Her mental status is normal. She did everything expected for a good, healthy mental status. After that, you're going to see if her level of consciousness. She's alert and oriented ×4. Then you're going to assess speech. How was she during all of this exam? Her speech was good and normal. She didn't slur her words. And then you're going to do movement of the face. You can just look at me. Can you smile? Frown? Clench your teeth? Put your eyebrows up and down. Good. So she's moving everything normally. You can also you can get a cotton ball to do this to see if like the patient knows what touch is, but just lightly touch. Can you feel? Tell me if you can feel this.
Mhm. Yes. Yes. Yes.
She can feel light touch. And then I'm going to have you stand up and walk. I want you to walk that way. Okay, her walk is normal. And then walk back, but do it toe to heel. All right, good. While you're standing there, okay, so her neurological part, everything, okay, stand and look face a little bit. Her neurological part is normal. Her mental functioning is good. She's alert and oriented, calm and cooperative, happy. Gait and balance are normal. She can respond to her face movements and functioning and light touch. So after that, we are going to look at the back at the thoracic and lumbar section. So turn this way. I just want to show you what a normal back looks like. This thoracic part is supposed to be a little convex, while the lumbar region will be a little concave. That is normal. So now I want you to touch and bend your toes, or touch your toes, bend down. Here you can see if there are any, look for any sclerosis here, but her spine is in a straight line. Also going back to the musculoskeletal, this would be a good time to also feel and palpate and look back and see if everything is normal here. All right, go ahead and stand up. Now we're going to check for range of motion here and see if it's okay. Put your hands on your hips. Can you bend to one side, bend to the other, and then keep your hips. Oh no. I hope it's still going. Okay. Sorry, my phone said low battery. Okay. And then spin around one way. Keep your hips still. Yeah. Spin around the other way.
Oh, keep my hips still.
Yeah. Okay. And her spine, you can set back down.
Mm-hmm.
Her spine is good and is in with normal limits. She had a full range of motion there. No abnormalities, no sclerosis. Her spine was straight. After that, the exam is all done. You would wash your hands, tell them thank you for participating, for being good, and then after that, you can assess just for the surroundings, pick up anything that is on the ground, look at their surroundings, make sure everything is in reach. If the patient might be older, they might not be able to reach something, so make sure they can't trip on anything and see if they have a safe environment. And then you would just say thank you and have a good day, and that would be it. And then after that, I will document everything and send it. Okay, thank you.